So here, I hope you're seeing it, COVID tracker. It's just so hard to know exactly what's going on, because when you see Alabama's curve, you'll probably see a similar, what looks like the starting of a decline in the curve. And Suzanne, I'm sure you'll comment on this. What's so hard to know about this is what the experience is truly reflecting, because it's faint, but you can see these just incredible spikes. So the day after Labor Day, we get 300,000 cases reported. So there's this still ongoing inconsistency in reporting from day to day that make these even 7-day rolling averages very difficult to follow. At least the latest that we're seeing here, 147,000 cases on average for the last 7 days, 1,500 deaths in the US, with 63% with 1 dose of vaccine and 53% fully vaccinated. So you see this curve for Alabama, and again, it shows the same thing, where we see these spikes because of the inconsistencies in day-to-day reporting from ADPH. Yesterday's report from September 9th, and you see the average here for the last 7 days, but the report number for yesterday was over 4,300. So again, very difficult to know if this kind of curve is indicating any beginning of a decline. We did hit 40% fully vaccinated. So that's a great milestone. It's some 20% below many other states, but it's better than where we were 2 months ago. So I'll take whatever improvement we can show. Again, 2,900 hospitalizations. It's still straining hospitals across the state, and 32 deaths. When I go to my places on my dashboard, again, I take these daily cases per 100,000 with a grain of salt, even with a 14-day average, because of those inconsistencies in reporting. But we're at least not seeing these numbers for Jefferson County and Birmingham over 100, which they were earlier in the week and last week. Here's the UA system dashboard from last week. Greater than 72%. So I don't know really what that means. I guess it could mean 72.1, but any number above 72 would also fit that definition. My guess is that it's close to 72%, 62% among students. And, that's pretty good. Actually, that's pretty good. It could be better, but it's pretty good. Here are the weekly cases from last week, and I'll come back to these. So let's go students first, 66 last week. And when you look at the student count from previous weeks, beginning in early August, 27 to 45 to 72, and I was really concerned last week with it being the second full week of class that we would see even higher than 72, and it was 66. So I like seeing 66 rather than something higher than 72. And the same for faculty and staff. So again, 22 to 33 to 27, and then back down to 16 for faculty and staff. Now the clinical enterprise folks went to 126, which is an increase from last week, although still lower than the week before.
If you look at what's going on, you do see these decrease in cases pretty systematically across all districts except Mobile, which, to be honest with you, Mobile has struggled throughout the pandemic. It reports very low cases, and then all of a sudden, on Tuesday, they reported 1,400 cases, which is like 5 times their rate. So I think they must have some unique challenges in terms of getting data reported. But basically all districts in the last week have started looking like they're coming down. One of the things that I look at just out of curiosity is, let's see, the way that looks by day, because one of the things that happens with the data is they're very subject to the day of the week they're reported. So this chart looks at what day of the week the cases are reported. You can see trends much better from this chart, because if you group all the Mondays together, they kind of tend to hang out in the Tuesdays and so on. And you can see, even looking at the day chart, that we are starting to see some indicators that cases are going down. So you can see here on Thursday, one Thursday to the next is going down, one Friday to the next is going down. The Wednesday is kind of holding, but it'll just be interesting. This is another piece of data to indicate we may have turned the corner. I showed you some children's slides last time, and the kind of update on the children's cases that are important to look at. These are the 0 to 17s, the yellow line. And what's particularly interesting to me in this group, at this point in the pandemic, the number of cases being reported each week in 0 to 17-year-olds is higher than any demographic across the pandemic. I mean, you can look back now, it's a bigger group because it's 17 years of life versus most of these being 10 years of life, or 10 age groups, 10 age years, but still that they've never been this high. And so this is also an indication of much greater spread in children, and or better access to testing in children. It could have been that earlier in the pandemic, children just weren't likely to be tested. If a member of the family had it, it was just assumed that they had it. So, it's tough to say exactly what this will transition into. I don't get updated children's data until Monday. So these data are 2 weeks old. The other interesting thing that I'll show for, food for thought is that if we look at what the models would have predicted based on multiple scenarios, UK, India, kind of taking it way back to where we were, the Alabama rate would have predicted us peaking somewhere around the end of August. The India rate would have been somewhere around this week. So again, just based on what most, or what other folks have experienced with Delta, it does make sense that we could possibly be seeing some peaking at this point in time. But again, I wouldn't say we're out of the woods yet. Next week is when we'd start to see cases tick up from football activities or there are lots of things that went on Labor Day weekend that weren't football.